thing that we speak about frequently here on All In with Brian Weatherford is that you need to have your team in place, a team of professionals that's there to help you any way that you may need help. Could be a mechanic, could be a dry cleaner, could be a hairstylist, could be a doctor, could be a dentist. Everything you need to have in place before you need it, because it's sure going to help in a lot of ways. Today we have a dentist with us today, not just any dentist, Dr. Becky Coates. She's the dentist. She is the owner of TMJ Plus Wellness Center right here in the Mid-Cities, North Texas area. And she's going to talk to us about a lot of things dentistry that maybe you hadn't thought of yourself before that could impact your life and you don't even know you need a dentist to help with us. Hey, Doc, how are you doing today?
Hi, thanks for having me.
Well, thank you so much for being here with us. So we were speaking offline here. You're up kind of in the Mid-Cities area, the South Lake, Colleyville, Grapevine, up in that area. How long have you been practicing there?
I've been here since 2003. This area's grown tremendously, and I'm right near Baylor Grapevine Hospital.
Oh, yes, that area has grown. Thank you so much for getting on board and bringing everybody in, because it's grown a lot since you got there. We're going to give you credit for the growth of the entire area. How about that? So I was looking at the notes before you came on with us today, and there's some things apparently I never thought about before related to dentistry that I hadn't thought of. For example, high blood pressure. I mean, if my jaw's mixed up. We were joking here before the show. I don't know if you could hear us or not, but the whole TMJ situation. Talk to us about what people misuse the term all the time. Talk to us about what it is and what people think it is, TMJ.
Right. I think most people, when they hear TMJ, they go classic with the, oh, I hurt right here in front of my ear, their jaw's popping. Really, TMJ, they mean that they have the dysfunction or the disorder, which really can be classified by clenching your teeth, ringing of your ears, neck pain, jaw pain, having your jaw get stuck or popping or clicking noises, and can even range into other symptoms that people haven't even connected yet, such as maybe even snoring at night.
Well, I'm glad you touched on that last one, because you're talking about all the different type of pain that you have. It can also, in extreme circumstances, create a marital pain with your spouse. If it gets you into snoring and grinding your teeth and popping your jaw and stuff, nobody wants to hear that. And so I'm kind of joking on that. That is a serious thing. But most of all, it's something you need to get looked at, and that's something that you specifically specialize in, correct?
Correct. This is something that I help many patients, not just in Texas, but people that travel from out of state to find these solutions. And it really is a problem with the family. So, in typical marriages, if one person isn't happy, the other one isn't either. You could be snoring like a train, right? But your spouse or bed partner isn't having a good night's sleep. So the problem could actually be their problem as well. But with snoring, classically, that's because you have an airway or breathing problem. And you might be thinking right now, well, how is that even connected to jaws? Isn't that a separate entity? It's actually not. So if your jaw slides back at night because you have like a poor dental bite, it actually can be pinching off your airway, which is what's making you snore. I think the more relevant health issue is sleep apnea. So it's kind of like saying that if you have a jaw problem, you might also have a snoring or sleep apnea problem, which is really tied to your whole health, as you mentioned, related to oxygen, whether that's heart health, brain health, or just basically not being moody and even depressed all the time.
So is the fix, if you will, for this, is it always surgical, or are there some non-surgical things that you can do as well to help people out?
Right. People come to me for non-surgical relief options. And I think when people hear surgery, they get very timid or concerned. So my relief options can be anything from basically, correcting the jaw position non-surgically. That might be a specific type of TMJ orthotic, as we call it, that helps drop the jaw and move it forward to a more relaxed muscle position, or I can't clench and grind my teeth. Same thing at night. You have to have a sleep study, which we can help order those for our patients. Now's the perfect time when people are at home. They don't want to get out to do testing. You can have a sleep study sent to your home, and you can be tested for the sleep apnea component. And our jaw, our TMJ appliances actually help the nighttime clenching and the airway and snoring, but they also have a different version during the day to stop your headaches.
You know, you touched on it briefly. Let's get into COVID-19 right now and how it has impacted what you do. Now, fortunately, even before we started going through this, you've always done virtual consultations or at least offered that to people. But has that jumped dramatically these days with how you can take care of your patients?
Oh, it's been a dramatic increase of those type of requests. So right now, during this time of COVID-19 and also people staying at home, I think that when people are at home, they're, more frustrated and stressed. So they're aware that they need to start taking care of some of these health issues why they are not going into work. Maybe they could do a Zoom meeting with me. So that's been so popular. I've been accommodating my hours during COVID-19 to better serve our families when they're done for school, or actually even evening appointments to share with people, because with these Zoom based consultations or go to meetings, you can see what's going on with someone's jaw, meaning how they're opening, if it's crooked, right?
Right.
Or I can see in the back of their throat for breathing, or tonsils, like with kids. Because really, this type of issue that we help is not just adults, it actually can be kids that are grinding their teeth and snoring. It's also linked to the ADHD, and especially parents right now that are doing their jobs plus their stay at home schooling. I think they're really paying attention to, why is my kid really wiggly and having attention issues, and they never would have seen it, right? Because they're at school, but the parents are now having a different perspective of the kids. So the virtual consults are just way more popular now, and it's something that's been routine for me for a long time.
You know, I'm glad you touched on that part with the kids being at home these days, and you're exactly right. There could have been some learning issues, if you will, that the child's been having, that the parent couldn't quite put their finger on it, because let's face it, if they're in the school, they have one teacher keeping up with 25, 30, maybe more kids. They can't really pinpoint everything. But now that we have that one-on-one situation to where you're seeing your child when you normally don't see them, things may come to light. And hopefully, by hearing this on the show today, they'll realize that I had no idea till you just said that ADHD could be tied to dental situations as well. So that's good to know, and maybe some people will find out some things. Maybe that's a little glimmer of hope, if you will, through the entire COVID-19 process, what we're going through, that the parents will realize how important this is. Are things like this, parents and kids, is this stuff, is it hereditary, or do we know that?
Sometimes it can be. So I like to believe it has to be with like the development of the jaw structure. Really goes back to the diet that we have in the United States. Everything's very soft diet. Most of the kids are developing with nowadays a really narrow this dimension type of jaw. So that's why a lot of kids are having breathing issues, ADHD, behavioral issues, and actually maybe they're not growing as quickly as maybe other kids, and it has to do with the airway and where their tongue is. A lot of the screenings that we do for our jaw and airway patients, actually, you wouldn't believe this, but it's true, it's a thing. You have to look at the tongue placement in the mouth. So a lot of these kids that are mouth breathers, if they have like a tongue restriction or a tongue tie, that's really what's causing their difficulty breathing and growing, learning disabilities. And if it's left like that as an adult, that's what leads into a long time in braces because of a narrow mouth, and even sleep apnea as adults.
Goodness gracious, who knew? You knew, obviously, and at least we were smart enough to get you on the show today, so hopefully other people will learn that as well. Thank you so much for being with us today, Doc. I appreciate that, and it's a tough time for everybody, but it's nice to know that long before COVID-19 came around, you already had things in place with your practice where you can actually look at people on the screen and help them out, and we don't want people to neglect their dental hygiene just because of what we're going through today. You're there to help them through it. Thank you so much for that, and we'll catch you next time on All In.